roll around. Between the winter blues and true seasonal affective disorder, along with the emotional strains of the holidays, the CDC reports substance use induced deaths tend to spike in December and January. As a matter of fact, since 1999, the CDC has seen nearly 91,000 deaths in December alone, making it the most dangerous time of the year. This year is even more troublesome with the pandemic in full swing and so many people dealing with the loss of loved ones, employment, and a sense of security, not to mention traditional holidays. So, how do you screen and assess for the need of a higher level of care among your clients? Furthermore, how do you approach your client with your concerns and recommendations? This can be tricky, especially if treating addiction isn't your specialty area. There are many instruments available, but my favorite is the SBIRT, Screening and Brief Intervention and Referral to Treatment. The simplest one is the CAGE, which only has 4 questions, and then there's the DAS-10 and CRAFT. Now, all of these can easily be found on the web, but I'll be sure to post them at the end of the video. Once you've made the determination your client meets criteria for a higher level of care, broaching the subject can be delicate, especially if the denial is strong. Now remember, as clinicians, we are highly skilled in to meet people where they are and also, make recommendations for change. This subject matter really isn't all that different in that sense. I found that clinicians who don't necessarily specialize in treating addiction aren't really aware of the many levels of care associated with treatment. Most clients will balk, of course, when you talk about admitting to the residential level of care. They tend to have family and work obligations, obviously. So, depending on which level of care they assess for, they could conceivably attend treatment at the partial or intensive outpatient level of care. So, there's not just one size fits all kind of option. When you present clients with these types of options, they tend to be a lot more amenable. Having someone to help navigate the process, there you go. That's the biggie. It's all about connecting to treatment providers that are appropriate in each individual case. This adds another layer of support for both the client and you, the clinician. It helps to demystify and simplify the entire process. And it also helps to ensure engagement and ultimately admission. It also ensures that the clinician is connected to the treatment team at the facility for progress updates and discharge planning. So, in essence, guess what? That's what I do. I help make those connections. I help navigate this whole process and help connect you and the client to these things so that it's a lot more simplified and seamless. So, that's really my role here is to make things more seamless, to ensure that transition and ultimately the continuity of care upon their return to you. So please feel free to reach out to me directly at 901 626 9271. That's my cell. So you can text me at that number as well. You can feel free to give that number to your clients, to their family members, to anybody you think that might need it. I can also be reached via email at karen.morgan@resurgencebh.com. May this be a holiday season truly of hope and healing for all.